that an enterprise fund? What is that under?
General fund, special.
Or a special revenue fund?
I'd like to call this meeting to order. Rebecca, would you please call the roll?
Mayor Paulette Guajardo.
Present.
Council members Roland Barrera.
Here.
Gil Hernandez.
Here.
Michael Hunter is absent. Billy Lerma is absent. John Martinez. Ben Molina.
Present.
Mike Pusley. Greg Smith.
Here.
City Manager Peter Zanoni.
Present.
City Attorney Miles Risley.
Present.
Mayor and Council, we have a quorum of the council and the required charter officers present to conduct the meeting.
Yes. Dante. Dr. Gonzalez, I should say.
Okay, Mayor, we're going to begin. So this morning we have our health department, and we know that this is first presentation under the new business model. And as Assistant Director, Dr. Dante Gonzalez will do the presenting today. We also have our Neighborhood Services Department. That'll be after the health. And then we're going to conclude with Development Services presentation on that enterprise budget. So just a reminder on the rest of the schedule. This evening at 6 o'clock, we have our fifth and final community engagement session on the budget. And then tonight it's in City Council District 5, hosted by Councilman Hernandez. And that'll be at Veterans High School for what is expected to be a pretty big turnout. That's why we use that little bit of a bigger venue. And those meetings are also broadcast on social media outlets to include Facebook and YouTube, so people can join that way as well. And then tomorrow, which is Thursday, we'll have another budget work session beginning at 9 o'clock. There's some pretty significant items on there, so we're working with Rebecca because we think we may need an additional meeting next week. We already have the Thursday one scheduled next Thursday, but it's possible we may need to meet Wednesday or whenever Rebecca can seem to get a quorum from the council. Because tomorrow we'll cover streets and stormwater, and we've gone over those presentations I have with the team for a couple of times now, and there's a lot of material there. That's going to take a little bit of time, especially to go over the stormwater program. We want to make sure we cover that thoroughly given the flooding that took place over this weekend. And then also for tomorrow is our gas utility, the engineering department capital improvement program, and then also scheduled, and this is the one we may move till that next week so we have enough time, is our water and wastewater operation. So it's at the pleasure of the council, and we'll be working with Rebecca today to see if we can accommodate that. So, and then finally, just to let the council know this, since it impacts the entire city, we've had some conversation about a Wi-Fi citywide or Wi-Fi at various locations like our parks or our libraries, and Councilman Pusley has brought up the CC Connect logo or application. So as it turns out, and we'll get more information for the council, we do have this service today. And so the CC Connect is a way to get free Wi-Fi at various locations in the city today, including at libraries, some of our parks and recreation,
City Hall.
facilities, our recreation centers, even some capacity at North Beach here at City Hall. So we're going to get more information out to the community and to the council. It's free Wi-Fi that's available right now, today.
Right.
At libraries.
But I think we were talking about expansion of that.
Okay.
Maybe to some parks. I mean,
Right.
You know.
Yeah, it says several parks today and community centers, but we'll see. So Peter's mapping it out for me and getting Peter Collins and getting the enterprise understood. And we'll bring that back to City Council soon. So I just want to,
Great.
since several council members have asked about that, the mayor has asked as well, that I'd share it this morning. Okay, so that kind of wraps up the housekeeping. We will be providing the council probably later today or tomorrow a memo that answers some of the unanswered questions from our first couple of workshops, and we're tracking others that don't get answered as well, and we'll follow up with a memo to the council on that. So with that, I'm going to turn it over to Dr. Gonzalez, who's going to go over our health department.
Thank you, Peter. So, good morning, Mayor, Council, and City Manager. Dr. Gonzalez, Assistant Director of Public Health. It is with great pleasure that I bring forth to you the first city-managed budget for fiscal year 23 for the Public Health District. With me today is our Senior Management Financial Analyst, Blendina Costley, which is a new position within the Health Department and has helped us tremendously in creating new policies that are specifically city and not city-county. So, today I'm happy to announce that after 6 months of negotiation, the Health Department became a full city-operated public health district. It was by unanimous vote by City Council and also with all the support of Commissioners Court. And so far, the Health Department has operated under this new model for almost 5 months. Actually, marks 5 months plus. And in the table below, I'm highlighting some of the significant changes under the old business model and some of the new business models. So in the old business model, we had a city and county shared 60-40 operations, meaning that we as employees had to report to two different people and operate under two different models. Today, we have a new business model, which is completely fully city, and the city is the exclusive operator. In the old business model, we also had city and county employees reporting again to two different entities. Now we only report to one city entity, which means that a lot of the processes, specifically when it comes to HR, finance, procurement, everything follows one guidelines. We no longer have to go to two city council meetings and then to two commissioners meetings just to get one item approved. That is a significant efficiency within the health department, and it allows us to move projects even faster than before. And then finally, and under the old business model, we were closed for almost 2 years. Effective March 1st, which is when the city reopened and became fully operational, the doors reopened to the community. Additionally, we're also providing optimal work environment for our employees, and we're providing services to the community in a mobile clinic setting. So we're going out to the community once a month. We'll be going out in a mobile clinic, and we'll be reaching the disenfranchised community, which is out in the county, some of these colonias, which we refer to, and provide those services that are so very much needed out there. We're also going to be providing services at the county level at the Calderon Building in Robstown, and we're going to be there twice a week. That's part of the new business model.
And the Calderon Building, we were there probably about 2 months ago with Commissioner Gonzalez and the architect. So there's still some finish out work that has to take place. It's basically a complete gut and remodel for the health district area of that building. But once the construction's done, that's when we'll begin service. The mobile clinic is available. We're going to do a test pilot. When, Dante?
Right. The county already did a dry run. So they basically took this huge mobile clinic to the furthest area within the county, and the county clinic was able to hold up. So we're going to be able to provide those services. This is a huge clinic, right? And we'll be able to provide on-the-spot clinic services to this community. So it was important that we assess whether or not this mobile clinic could go to these places, and it can. Some of these places are really rough, right? You have to travel some of these dirt roads. It's able to go through that. So our mission statement for public health encompasses our pillars, which is prevention, promotion, and protection for overall community wellness. Our specific mission is to prevent disease and disability, to promote healthy lifestyles, and to protect the health and the quality of the environment for all residents. So below here, there are some of the 30 different services that we provide to our community, which include environmental consumer health services, which we go out to the community and do restaurant inspections, pools inspections, septic tank inspections. We've also been heavily involved in COVID-19 vaccines and vaccinations and testing. We also have our WIC program, which is Women's, Infants, and Children, and we have immunizations. We just recently finished our back-to-school immunizations, which is a great success. We were able to provide vaccines at the health department since now we have opened up our doors. And then we have a new program, which is Charity Care. This is a program that is going to be developing. We're developing the infrastructure. We have a really good plan on how we're going to provide services to the community. And there is a financial burden statement. If you can't pay for some of the services will be provided to you at no cost. So if you under the news program, correct.
Wonderful.
That is one of the efficiencies that we brought forth into the new public health district. So a little bit more about the health department. With the onset of a new business model, we have also adopted a new modern and more efficient public health program, which we refer to as Public Health 3.0. Under this new model, public health is moving forward and summarizing our efforts to be the chief health strategist for the region. We also have enhance and modify we're going to enhance and modify our funding to set up the scaffold to receive more grants and better services. We also are creating and utilizing actionable data and becoming public health accredited. And we're also enabling a cross-sector collaboration of all which focuses on health equity and inclusion. Some of the things that we do there at the health department is investigating over 100 plus unique communicable diseases. This means that we make the contact with the person who has a communicable disease and we prevent the spread of this disease. We also provide over 12,000 restaurant inspections and permits, and with the addition of a new and efficient processes, we're also going to be able to go to a restaurant, and if there's a foodborne illness disease that was reported to us, we're going to be able to work together with the business owner as well as with the manager there at the restaurant and be able to provide services that were not provided there before, which go from food handling all the way through food storage and really narrow down on where that foodborne illness could have come from. We also have one of 13 BSL-3 facilities in the state. This is our counter bioterrorism facility, which is able to provide really fast results, which we have seen. Within 6 hours, we can isolate a virus and tell you what the virus is. We also are able to look at bacteria and grow it in-house in culture so that in the event that there is a bioterroristic threat that is local, we're able to remediate it and resolve it very soon, or at least isolate it so it doesn't spread to bigger areas. That is one of the best benefits of the health department. Since we're able to do that here in-house, we don't have to ship out anything out to the state. We also conduct water surveillance on more than 40 miles of Gulf Coast water. So we go out to the coast, we go out to the beach, and we collect water, and we report out on a daily basis the levels of bacteria that are within the water. This is important for our community because if you're immunocompromised, or you just had a recent incision, or you've had an open wound, you're able to look at the levels of bacteria within that area, and if that area looks to be a little bit high, then you can choose another area within the map. And then it shows you in life what the levels of bacteria is. We also provide over 13,000 annual tuberculosis prevention screenings, and we also provide, on average, through WIC Clinic, at any given time, we have almost 4,200 pregnant women that we're providing services, infant and children. Our organization is as follows. We have our interim director, which is Steve Vieira. We have the assistant director, which is myself, and then we have 3 public health administrators, which focus on the 3 pillars of the health department, which is protection, prevention, and promotion. With the new model, we also have centralized our accounting department and added a senior management financial analyst, which is Blandina Costley, and she has been helping clean up financial policies. As I stated before, we had 2 different financial policies where the county and the city now, the employees don't have to worry about having 2 different policies. We have one policy, which is the city policy. That is, again, another efficiency in providing better services to the community. And then also helping establish new processes and meeting our grant metrics. Especially right now, we have some money that was provided to us from grants, and we're bringing in more grants from the county into this new model. So blending has been a crucial component in that. We also added a project manager, all of which is going to be reporting to the office of the director. And then on the side, we have our local health authority, which is Dr. Ramachandruni, an MD. We also have our pharmacist, Dr. Stanford, and we have a Class D pharmacist there within the health department, and he manages that. And then we also have our pathologist, which is Dr. Simonson, and he does the laboratory approvals of any pathology services that we provide. For FY22, some of our greatest achievements was that the city became city-operated public health district on March 1st, 2022. Our second achievement also landed on the exact same day, which was we reopened our doors to the public, and we started providing services the same day. Our achievement number 3 was WIC had navigated through the national baby formula crisis, which was something that as a pregnant and as a family person myself, we're concerned about. We were able to navigate through that. Not only were we able to navigate through that, we were also able to increase and grow our participation here locally, something that nationally the participation has been going down. So we did a tremendous amount of job there. And then our achievement number 4, which is our biosafety laboratory, which is our BSL-3, received recertification and successfully set up testing protocols for monkeypox, and we serve over 13 different counties within our region. So we not only provide those particular services, but the state will sometimes call us, since we're the nearest BSL-3 facility, and they'll send a sample so that we can run it for them. If we were not available, then Region 11, which is down at the valley, would have to send the samples all the way to Austin, and it will take a couple of days, maybe between 5 to 7 days for it to get results. We're able to do it. If they drive them down, we're able to do it within the same day or the next day. So as alluded earlier, we have over 30 different services there at the health department, some of which include restaurant inspections, septic inspections, food handler permits, and with the next fiscal year, we're also adding 3 new positions. 2 of them is going to be for the program that I alluded earlier. We're going to be able to go to a restaurant where food illness has been reported, and we're going to be able to work with that the restaurant owner or the manager of the restaurant to be able to narrow down and stop the spread of that particular food illness. We also have we also have other programs. My apologies. We also have other programs, which is community health, immunizations, tuberculosis. We also have education, health education, vaccine preventable diseases, and diabetes education. Some of these services which are being provided there at the health district. And we also have our clinics, which is at Horn Road, and we're going to have the 2 new clinics, which are Calderon and the Mobile Clinic. This brings us to our proposed budget for FY23. Our proposed budget expenditures is $33.6 million. That is a breakdown, which is $5.3 million in our general fund. That is a $1.7 million increase, which I'll cover in the next slide. Our grants funds, which is $26.6 million, and our 1046 and 1049 accounts, which are amend and waiver accounts at $1.7 million. And since the county no longer provides a departmental budget, but rather they provide a service fee, the budget there, you'll see a decrease there since it's not a budget, it's a service fee. So that is shown in the next slide. On our position for FY 2023, we have 115 positions. We increased our position in the 1020, which is the city general fund, by 21. That is because we are bringing our county employees into the city, and so that increased that number there. In our 1066, which is our city grants, those grants, every single grant was converted will be converted as of 9/1 into a city grant. So you see an increase there for those positions as well. And then for our 1046 and 1049 charity care, which is our waiver program, we have 4 positions there. If you see on the bottom, the county general fund and our county grants and programs, you see that there's going to be 0 positions there. That's because they have been moved to the city and they are now city employees. You'll see a variance there overall of -8. We have vital records, which is being moved from the health department into the city secretary's office. So those positions account for some of that. And we also have some dormant positions that were not funded on our WIC program. And those positions had not been filled and were not funded. So we are removing as an efficiency to clean up some of our position control. So a breakdown for our 1020 account, which is our general fund, we have proposed there $5.3 million. Most of the revenue that comes from there is very minimal when it comes to programming. We provide a lot of free services to the community. Our lab only provides $20,000 in revenue. Our community clinic is not a substantial amount. We receive most of our funding through general resources. Environmental does bring $600,000 into revenue, and then with our new service with the county, we're receiving $1.7 million there. For our 1049 account, we're proposing expenditures of $1 million. So with that, we receive our 1049 Waiver Services revenue. That is another service that we're receiving. So that is $1.6 million in revenue, and we're proposing to spend $1 million there. If you see on the bottom corner of that figure, what you'll see is that in the previous year, we had 7 months worth of expenditures, which was about $800,000. Since we started operating on March 1st, now that we have a complete year of operations, we have a FY23 for revenue. We've requested $1.5 million from the county. And with that, I bring probably one of the most exciting things that is happening there, well, aside from what I've just discussed, but a very exciting project, which is and very needed, if I must say, is the renovation of the Public Health District building. This building was built in the 70s and has not seen any sort of renovation. If you walk in there, it really looks like it's not modern. It's not a very efficient building. With this renovation, we'll be able to not only modernize public health, but we'll also be able to provide better services to the community. We'll be able to be more visible to the community. Most of the time, people will ask us, like, where's the health department? They drive right in front of it, and they don't even know that we exist. This is going to bring that visibility to our community. It's going to bring better services, and maybe we'll start saying that the library is next to the health department instead of the other way around. Usually they say, well, if you pass the library, you pass the health department. So this project is going to be done in 3 different phases. Phase 1 is projected at $5.4 million. It's going to take care of some of the efficiencies in administration. Phase number 2 is going to bring better services in our clinical, and is going to optimize our clinical space so that we can be able to bring in patients, be able to sterilize accordingly, and be able to have that space specifically designed for clinical services. And then phase number 3 is going to be the rest of the department, which is where our preparedness, we'll be able to store some of the items. We'll be able to have space for our public health emergency preparedness. So in total, this project is projected to cost $16.7 million, but it's going to be 3 different phases.
Right. Can I just add to that too, Dr. Gonzalez, that we, when we took over the operations of the health district, we did an emergency contract with Spa Glass to assess the building, because at the time the roof was questionable. There's water infiltration under the foundation, and there was claims of interior environmental issues. So Spa Glass and other consultants looked at the building, and environmentally inside it's good, clean bill of health on the inside. The outside does need some envelope sealing and some minor things to the roof. And so along that scope of work, they also identified how could we, well, first we asked them, is this building salvageable for the city? Or should we tear it down and build a new one? And they said the building structurally is very sound. It's probably financially prudent to rehab it. And interior-wise, I think the price difference was 3 times as much, or even greater, to tear down and rebuild. So we think that's a good plan moving forward. So the $5.4 million project will have to be bid out. That'll be procured out through a competitive process. We have $2 million identified right now. And we'll work to see reprioritization of other facility projects, namely some projects here at City Hall that are in our capital plan. We may redirect those dollars, recommend that to council to be able to fully fund phase 1 at 5.4. So more work has to be done to identify that funding. But the good news is through the last couple of months, an assessment has been done by a professional engineering company, Spa Glass. We have a good plan of action on how we can rebuild the inside of the building to make it more customer service oriented, and also a better place for the employees, frankly, and more efficient, as Dr. Gonzalez has said. So more information on that will be coming forward. I just want to share that update because we did talk to the council back in March timeframe. I think that concludes your presentation.
And
Dr.
that
Gonzalez?
concludes my presentation. I'll take-
We have, let me go in order here, Councilman. Councilman Smith?
Thank you, Dante. On there, so I'm going on page 9 that this is the health district budget, and we were showing in 22 that the county contributed $1.5 million on there, and then 23 it's nothing, but we're showing on the next page, page 10, that the county is contributing 1.7 million to 1020. Is this kind of Eddie, is this a pass-through? What's the net result? So as I look on page 9, I'm seeing we're going from 3.6 million to 5.3 million with it, but do we get the 1.7 going in the general fund? Is that just kind of passing through? So net-wise, we've only got a marginal difference, actually a little bit to the good? Okay. Okay.
The answer is yes. So we're taking the budget that we've had for years. We had, like as I mentioned before, we had two budgets. One budget that we ran through the city, one budget that we ran through the county. So the $1.7 million is the budget that's coming into the city so we can operate with those funds. And we're providing the same services.
Yeah, and what I'm saying, just looking at the budget, okay, we're jumping 40-something% from 3.6 to $5.3 million coming out of the general fund, but now we've got new flows going into the general fund that we didn't have before, and that was the county contribution.
That is correct.
So we're good.
We're good.
We're not adding to the city taxpayers' burden by doing
You're
this.
correct, right. In fact, Steve and Dr. Gonzalez have been at the county twice as they've negotiated the payment to the city. And just tell us, Dr. Dante, the amount they paid in 2022 versus 2023. Is it the same or a little bit more, I think, right?
Yeah.
Right. So the amount that they paid in 2022, it was $943,000, but that was only for 7 months. For 12 months, they're paying $1.7 million. So if you add up if you were to take apples to apples, it would be about, a difference of about 10% more.
Yeah.
So they're adding 10% more
Yeah.
in terms of money
Yeah.
that we're receiving at the city.
So even though we're seeing a 40% increase on that general fund line, we're getting money coming into the general fund and we're coming out to the good.
Right.
Now,
Correct.
Then what are the waiver services? What exactly is that?
So the waiver services are services that were provided. It was a program that was designed to provide services to the community. And then these services, in turn, were services that were billed to the federal government, and then the federal government would then give us a reimbursement of all the services. Well, some of the services that were chosen to be provided in the 1115 waiver were things like diabetes screening, nutrition classes, blood pressure, BMI, and just an overall community outreach component. We have some patient navigators that were being paid out of there. Those services continue, right? We still have those services there. We're still providing those to the community. It's just that when it comes to the operational costs of those particular things, where you have to buy A1C cassettes, to go out to the community, they're expensive. So we still do those, which is why that program is at 1.5.
And financially, we've got kind of the same thing going on there, that we're just changing some lines on the books, but it doesn't have any kind of material impact on our
That's
overall
correct.
budget.
And if anything, we are able to make more efficient changes as to that. We'll be able to provide those services even at the Calderon Building with the same amount of money and provide the same services that we're providing here at the Health Department. We'll be providing there also in the mobile clinic. So.
And your employee count dropping 7% or 8 positions, that's because of these efficiencies that you've been able to achieve?
We had
So the service levels are the same, you're just doing a more efficient job of doing it?
Actually, our service level is even better. It has
Okay.
improved. Our community has come in and told us that they're very happy to receive some of these services. We're doing a complete level of service of care now, where they come into us, and if we can't help them out, we have partners and community partners that we can refer them to, which in the past we were able to not do that. Right now we're also providing services where we take them from the 1115 waiver, and we see that they have they're missing some of their immunizations, or we ask them if they have immunizations, we're able to refer them back to our program. So we really give them a complete care throughout the health department. So it's a more efficient process that we're doing it.
Yeah.
And I don't think we're providing the same level of services. We're providing more efficient level of services.
Yeah, so you're touching more people with less. You don't have, okay. Well, thank you very much. Great presentation.
Can I just add to that, Councilman Smith? Some of the reduction is from the transfer of, was it 4 positions or 3 to vital records? So the health district in the past provided birth and death certificates to the patrons that needed those. That, consistent with statewide best practice, is transferred to the city secretary.
Yeah.
And that's being provided today under her leadership here at City Hall. So that's the somewhat of a reduction, but others are from those efficiencies as well that you talked about.
Thanks.
Councilman Pusley?
So, Peter, on so you said on the design and construction improvement plan, you haven't identified the funding for any of that yet?
No, we have 2 million of the 5.4 million phase 1, so 2 million's identified. When we issued certificates of obligation most recently, we included a 2 million allocation for the health district, knowing it needed some stabilization to the envelope. And then so we need to identify the 3 million to be able to fully fund that phase 1, which is 5.4 million. So 2 million's available, 3 million needs to be identified.
Okay, well, 3.4 million.
Yes, sir, 3.4 million.
Okay. Well, it's been a long time since I've been in that building, but the last time I was in there, it desperately needed revamping then.
Yeah.
So I know it hadn't gotten any better.
I don't think anything's been done to it since it was built in the late 70s.
Yeah.
Yeah, it's all, it's real.
When I went over there, it looked like the trees hadn't been trimmed in 10 years, so.
Well, we did do that. Dr. Gonzalez got that under control, and
Good.
there's things that we're trying to do to preserve deterioration, to eliminate degradation of the building. There's some soil that's been pushed up to the wall, and that doesn't allow rainwater to drain away from the building.
Right.
There's also some exterior envelope things we need to do to make sure we protect the investment.
Okay, so you'll be coming back, will we identify that 3.4 million for this year's budget?
It's going to come from the capital improvement program, and what we're thinking is we reprioritize some of the city hall work that we have lined up in the CIP. We have a pretty aggressive plan for city hall to include maybe some window replacements. So we may recommend deferring those for a later year and then using that capacity to fund this project.
Okay.
Yeah, that work still has to be done, so we'll be coming to council maybe a little out of the budget cycle
Okay.
to do that.
That's great.
Yeah.
Oh, I'm
Alright.
sorry.
And then the final question I had was, Dante, I thought I heard you say, I want to make sure I was right on this, that all the grants that the city county health department in the old structure was receiving are now city grants. They're now being sent to us under the name of the city of Corpus Christi. Is that correct?
That is correct. So what we've done at the health department is that we've taken the grants that were at the county and we converted them into city grants. So we're working with the state, working with the grantors to create amendments, and those grants were brought to council already. They will be converted 9/1, effective 9/1. The grants will be converted to the city. So all of the county grants that needed to be converted to the city have been converted.
Okay. So there's no longer a problem with that? And
No, yeah.
the name on the building can change and?
Right.
Okay.
Yeah, part of the efficiency of the ease and transition was that we maintained the health district name, and we're still a district, and so the state Department of Health felt comfortable just transferring the grants over to us. There's 2 grants on next week's city council agenda that prior to this point had been county grants, so the new grant award will be in the city's name. That's a good example where next week 2 grants on the council agenda in the past would have gone to the county commissioners, but now it's coming to the city.
Coming straight to here.
Yeah, so one of the guiding principles that we had was no interruption in service or lost revenue.
Sure.
And we're able to maintain that. So all the grants, there was no interruption, not even a day of interruption. And so all the grants transferred to the city, and renewal grants come to the city like next week on city council's agenda.
Okay. Dante, how do you think the overall morale of the employees in that building are now compared to a year ago?
Oh, I mean, I've been there I was there for a while, and I can tell that the morale has significantly improved.
Yeah.
I have people that are actually coming out. They're coming in. They're pitching their ideas, right? That's part of of what we're doing now is listening to our employees, right? They're the hands-on, right? They're the ones that are doing the community work. They're the ones that are talking to the community. We as administrators are listening to their input. We have weekly meetings where we meet with, bi-weekly meetings where I meet with the managers and the PHAs, the public health administrators, and we take their ideas, and then we create business model changes with that. We're making things more efficient. We're listening to our employees, and they're very happy about that. Also the fact that they don't have to follow two different financial policies is a complete. At first, it was a little bit of a readjustment, right? But now that they see that we only have one policy to follow, it's a lot cleaner. We're able to provide guidance that is specific, and we don't have to take items to two different places.
Right.
And then also we have an employee where they go in, they eat their lunch, and I've seen that increase. People are actually taking their lunches, they're engaging with other, and nobody's in silos. So that has that shows that there's a tremendous amount of morale increase there, and people are happy. I'm happy.
Well, that's great.
That's right.
I think it's been a great turnaround, and from where they were a year ago or 2 years ago.
Significant.
So hats off to you and Steve and everybody involved, and Peter in making that transition as smoothly as it went. So thank you very much for your dedication.
Right, and can I just add to that, Mayor, that this is another, we talked yesterday about some of the legacy and significant policy things that this city council has done, and this is one of them.
Right.
Where for 30 years, 3 decades, councils have tried, commissioners' courts have tried to change this business model, but you all did it. We're very thankful that you did, that you had the guts to do it. And you can hear, not only is it benefiting the employees, but also the community. And that was the goal, so, yeah.
Councilman Hernandez.
Thank you. Okay, Peter, just for reference, in the CIP, it says you have programmed over the next 3 years $13.5 million in certificates of obligation for the health department building. But from what you stated, it is, you want to transfer what I'm assuming, certificates of obligations for this building over to that one. So is it, how is that working?
Part of the overall debt capacity is what we're talking about. So that may be the case in the book here, but we need to lessen it in other areas so that we're not overextending in the issuance of COs.
Well, you understand my opinion of COs, so we'll leave it at that. Dante, it was somewhat difficult to track your budget because you kind of have 1 foot in the general fund and 1 foot in the special revenue fund, and so it was kind of difficult to kind of track along. But you still have several items in the general fund, like the TB clinic that has several items. You have some professional services that were left over from. Excuse me, the TB clinic is still in the general fund. Can you kind of explain that?
Yes, so we get services, we get funding from the state to do TB services. There's still an operational cost for TB services that have to be paid for, that sometimes the grants do not cover. Some of the funds are redirected from the 1020 account, which is the general fund account, to be able to pay for those services. And then sometimes it's not services, sometimes it's equipment, general maintenance of the building, allocations of services such as IT, and those matters.
Okay.
Building support.
All right. You have general operational stuff. Salaries, clinical supplies, clothing.
Correct.
Fuel.
Right.
So is that going to stay in the general fund, or is it at some point going to transfer over?
Do you mean it's going to transfer it to a grant, or
no, to the special revenue fund where the health department now?
So this year we're receiving revenue, from the county. In the past, we had accounts that were specifically designated to pay for some of those services, which is TV. The manager gets paid out of the TV services general fund. As we move forward, right, the services and the fee that is being collected, the membership fee, obviously is going to have to be moved into different funds. So that is what's going to happen, right? We're receiving the funds from the county, and then we have to like TV services has to charge some of the services to that. So yes, those funds will be moved over to TV.
Okay. Looking at the revenue fund, the amount of professional services that is budgeted compared to the previous years is almost, looks like about a $450,000 increase. What are you going to be utilizing that for?
Well, professional services include services for our contracted employees. Our local health authority in the past was 50/50. So that has to be paid out of somewhere from a city fund. Professional services, a local health authority. Our pharmacists.
Separate, right? I didn't ask about that one.
Um,
I mean, the TB clinic is in the general fund, and you have $30,000 programmed in for professional services there. So, but this is just strictly the, and I'll give you the Medicaid 115 transformation waiver. It's an acronym, so it just says Medicaid 115 FRMTN waiver. And you have professional services, and you have several amounts of $700,000, and you have two different budget line items, one for $700,000, one for $440,000. If you can't answer it here, that's okay. You can get me the information.
No, I mean, I'm trying to figure out specifically, right. So we have two accounts, which was the 1046 and 1049. Can you just specifically, I'm trying to follow you on the book here. You have.
Yes, there's two. The 1046 is a $700,000, and the 1049 is a $440,000.
Okay. So you're specifically asking about the 1046?
1049. The 1046 is equal to what you had previous years, but the
Right.
1049 is something new. Is a different amount. You didn't have that budgeted.
Right. So that is one of that's one of the things that we're bringing from the county, right? So the 1115 waiver previously had its own separate budget from the county as well. So the 1115 waiver ran, if anything, if I could say it in such, as we had three different budgets. We had one budget, which was the city budget. We had a county general fund budget, and then we had the 1115 waiver budget, all of which were run different ways. The 1115 waiver budget is now the 1049 budget. So all of the services are being transferred into that, and that's why you see that $1 million expenditure there.
Yeah, like I said, it was very difficult to kind of track. Are we going to leave the TB clinic in the general fund in the future, Constance? Or
Well, I mean, TV services are provided by the general fund, right? Again, we supplement that with some grant funding. There's still some operational costs there for the TV. They have some staff there that is not paid for by the grants. I mean, there are some.
Well, this is a budget thing, right? So, I mean, you could transfer funds from the general fund into the special revenue fund to pay for the TB clinic. I just don't know why it's kept in the general fund. Eddie, or Constance, can you explain that? Okay, I just, if we're going to move into the special revenue fund, let's move everything over. It doesn't make any sense to just keep one portion in the general fund.
And you know, it's. I agree with you. Again, we've had 7 months, and we're working on that.
It was really difficult to track. It really was.
No, I think that points out to the fact that in the past we had to deal with this type of level of difficulty in budgeting processes. Right? We had services that were being provided by the city. And then we had some services that we've been provided and funded by the county. So now that they're both being provided together, I think next fiscal year, whenever we bring the budget, you're going to see an accounting stream that is specifically just for the 1020. You won't have to see, what the county was previously funding or what the county is going to be funding. So, to your point, it is difficult, and I think you see the level of difficulty that we had in the past.
It was hard for me to track it all and try to, go from the general fund over to the special revenue fund and try to match things up. It was more difficult.
Yeah, and not disagreeing with that. I think in future budget years, I think you will see that cleaning of accounts to where we're removing everything, and there is not a 1020 account, a 1049 account, it's specifically a general fund account.
All right. So in the future, if we can figure out why the TB clinic is still in the general fund and not in the special revenue fund, and we can get an answer on that, it should be on just for, keep it all clean and neat, it should be in the special revenue fund under the health department.
Okay.
Okay, and Peter, if you, okay. All right, thank you.
We'll get back with you on that, Councilman.
Thank you.
I think that's all. Councilman, did you have a comment, or is that an old light? Okay, yeah, you're fine. Okay, Dante, thank you. I know, as was mentioned, and Steve, I really want to thank you. I know you've taken up that interim position, and it's a huge feat. As Peter mentioned, all of this is a huge feat, and I have personally, usually at HEB, where I encounter people who work at the health department, and they are the most happiest. It truly, as you mentioned, Peter, this is I say it again, I say it every time, but it is it's a historic event in the city of Corpus Christi that this is actually has happened. And it is for the betterment, as you mentioned, of everything and everyone. So I commend you all. Again, Steve, I know you've really taken on a huge feat in working, both roles. I don't know, I think you have actually 3 roles right now. So thank you for everything everyone is doing, all of you at the health district. And I look forward to all of these programs just really benefiting all the children and the people and the moms and families of Corpus Christi.
Thank you very much.
Thank you.
Great, thank you, Dr. Gonzalez, and the fiscal person as well.
Yes.
Okay, great. Mayor and Council, we have our next presentation, which is on our newly emerging department, Neighborhood Services, and our new director, Linda Stewart, is going to present. I failed to mention in the beginning, Mayor, at 11:45 or maybe a little sooner, the council is scheduled to break. We do have a noon press event here in the City Council chambers that the mayor, the county judge, the state delegation, and the Port of Corpus Christi chair wanted to convene with TxDOT to talk about recent information that was shared with TxDOT yesterday, outside of any other agencies being there with TxDOT. So today's press briefing is to bring all those parties, including the state delegation, the county, city, and the Port of Corpus Christi together with TxDOT,
Right.
so that collaboratively all agencies can understand and present to the community and the media what transpired yesterday.
Right.
So just to remind the council on that. So 11:45 or a little before, just so we can get the city council chambers set up for that media briefing.
Thank you.
Okay, so Linda, thank you for presenting this morning, and we'll turn it over to you.
Thank you, Mr. Zanoni. Good morning, Mayor and Council. I'm Linda Stewart. I'm the Director of Neighborhood Services, and I'm presenting on behalf of the team our proposed 2023 budget for you this morning, which focuses resources to stabilize, enhance, and sustain service delivery while continuously improving our program performance. But before we begin, I want to recognize the efforts of our team. I joined the organization on June 6th of this year, and what I consistently see is a commitment to our mission of service to our city. And this team meets up every day, ready to meet any challenge, and they pivot on a moment's notice, and they really are pulling together in service, so I want to just appreciate them publicly. So let's go ahead and get the slide deck loaded up, please. I'm going to drive. So Neighborhood Services, we were established in 2021 to make it easier for community members to access services. Our work aligns with council priorities of community and economic development, enhancing quality of life in all neighborhoods, and ensuring access for all to programs and services. We are funders and we are regulators. We administer and monitor grants and general fund resources, and we ensure compliance with local, state, and federal regulatory requirements. We contribute to, We contribute to the council's vision of community by connecting residents to services and opportunities to access funding for home improvement and home ownership programs, addressing property maintenance issues and ensuring compliance with city code, fostering revitalization, and encouraging a culture of compassion for animal welfare. So we've worked through the city manager's office to bring 4 quality of life ordinances and the consolidated action plan for council approval. Those 4 ordinances were related to prohibiting parking on unimproved surfaces or residential lots, emergency demolition of dangerous buildings due to sudden acts, and short-term rental programs. We also completed the Consolidated Annual Action Plan and continually work to improve our services. Slide 16 here is our organizational chart, which reflects how we're deploying our most valuable resource, which is our people. Here in slide 17 are some of our 2022 highlights. We've expanded access to microchipping, not only helps pets return to their owners, but also assists community members with complying with local and state law at no cost to them. Microchip pets are more likely to be reunited with their owners than pets without them. And Chapter 6 of the Corpus Christi Code of Ordinances requires that all owners have their pets microchipped, which acts as the official pet license. This is also required by Texas state law. A fun fact here is that ACS facilitated the return of 407 animals to their owners because of microchips. These are 387 dogs and 20 cats were returned home. Animal Care Services performs spay-neuter services and microchipping procedures, but has limited capacity and cannot handle the demand. One of our current partners prioritizes animals located at ACS, which all must be sterilized as part of the adoption process. Incentivizing adoptions by providing no-cost spay and neuter assist with the placement of animals. Increasing access to these services also helps address issues of overpopulation and improves animal health. Our code compliance efforts are yielding an 83% closure rate for code cases. The headline here is that overall, we're closing more cases than we're opening. Compliance is defined as city-abated, case closed due to homeowner or tenant compliance, case closed due to no violation found, case closed due to duplicate cases, and this means that more than one concern was reported to the same residence or the same location. Housing stability needs were addressed by focusing on preventing rental assistance through the Emergency Rental Assistance Program, ERAP, and Texas Emergency Rental Assistance Program, TRAP, as well as housing program services for residents who can't afford to build, buy, or rent homes to meet their basic needs and provide decent, adequate housing. These programs also added value in neighborhoods by stabilizing, enhancing, and sustaining quality of life, like improvements of city park facilities such as Ben Garza locker room renovations. Here are some performance measures that we're using to validate the effectiveness of our efforts. And again, because microchipping is so important, we want to increase the number of no-cost microchips made available. Distribution of microchips with partners will allow microchips to be implanted at no cost or low cost to the owner. We covered in the last slide why this is so important, and as you can see here, we've improved our number by about 1,000 from fiscal year 2021 to fiscal year 22. We did this by initiating our Microchip Thursdays and then expanding the service to Monday through Friday. Corpus Christi residents can come to ACS, Animal Care Services, located at 2626 Holly Road, to have their pet microchipped. We're also tracking our progress with spay and neuter surgeries. As you can see here, there was a decrease in surgeries this year due to a decrease in capacity for us to provide the services. The proposed 2023 budget includes resources to stabilize and enhance our ability to more than double the number of surgeries provided. We'll do this by increasing our support of community partners to perform spay and neuter surgeries. The $500,000 in the proposed 2023 budget will be made available for community partners via a competitive funding process, and we'll talk a little bit more about that later. We're also looking at code response times. You'll see in a future slide an enhancement request for funding to develop operational business plans and a strategic plan for code compliance and for training and development. In order for us to enhance and sustain best practices, we need to stabilize the team, provide training for staff, assess our workflows, standardize approaches, and develop a plan to align everything we do to industry best practices. Code case response time is the entire code enforcement process from initial inspection to case closure, which was estimated this year to be 60 business days. Our service level agreement on response time for initial inspection of new cases, which is different from the entire process, is 10 days. But we're usually way ahead of that and getting to an initial inspection time of 3 to 5 days. We want to mention here that since there's a difference between initial response time of not more than 10 days and case resolution, there is a difference. For fiscal year 2021, the average code case response time, again, resolution of cases, was 35 business days. We initially expected for the response time to be 60 business days this year, but the current trend is closer to 38. That's how hard this team is working. Now let's jump to fiscal year 23 as we continue to look at ways for continuous improvement of process efficiencies. The target for fiscal year 2023 is to improve upon our estimate as we work to reduce the overall code case response time by 15 days, from 60 to 45. While it might look like we're going backward, we want to set a realistic goal, and then we'll all celebrate when we do a better job. We'll mention here that code staff frequently assist with special projects like currently the water restriction enhancement, the enforcement efforts, where our team is working 7 days a week, morning and evening, and we're still confident that we will continue to maintain the trend of 38 business days for standard code cases. In terms of homeowner and support services, housing conditions were improved by making repairs, demolishing and reconstructing substandard homes and empowering individuals to become homeowners. These programs provide a multi-pronged approach to stabilize, enhance, and sustain homeowner supports in our city. Homeowner supports include the minor home repair program, rehabilitation program, and the first-time home buyer assistance program. Numbers went down in fiscal year 2022 because there were fewer home buyers due to a number of issues that are not isolated to our city. These are things like affordability and increasing interest rates. Low-income home buyers struggle to qualify for first-time mortgages, making it more challenging for them to buy a house in the current economic environment.
Linda, can you advance the slide?
Advance.
Thank you.
Did you want to see this part before I'm finished? Okay.
No. I just,
Advance the slide.
well, no, she would, never mind. She was going from, no, she was on the previous slide to this one. Never mind.
So I'll just wrap up I'll leave it there for you, Councilmember, and then
right,
I'll wrap
all
up
right.
on the previous slide. I just want to add one more piece. There are substantial waiting lists
No.
for the repair and the rehabilitation
Councilman,
programs.
no, this is a department.
We've got a waiting list for the minor home repair programs of 113 households, and the waiting list for the single-family rehabilitation program is 99 households. So we're working on making our way through the waiting list. Homeless individuals seeking resources within, if you don't mind,
Go ahead,
Councilmember,
go
I'm
ahead.
going to go back one. Just to touch on that last point there, homeless individuals, at that last part there, individuals accepting homeless services, homeless individuals seeking resources within the community were provided services through a collaborative joint effort with our partner agencies. We want to deploy funding from the Texas Department of Housing and Community Affairs in 2023 to increase provider capacity for street outreach so that we can get unduplicated numbers and improve our system for tracking when individuals accept services. So, for example, the providers who are doing the outreach need additional resources. We are going to pass through resources that we're getting from the state, and then we are going to help them by providing some additional technical assistance to boost their efforts and their efficiency so that they can actually tell us what's happening out in the field. That's going to be a really big thing. Okay. We are going to move on to general fund and grants. So the neighborhood services budget is 60% general fund and 40% grants. That's what you see on the slide here, 19. We've got variance in grants due to COVID-related resources that came in 2022. The grant reduction is due to one-time allocations that came in 2022. Grants included here are Community Development Block Grant, Home Investment Partnerships Program, Emergency Solutions Grant, Homeless Housing and Services, Ending Homelessness Fund, and the Chenier Foundation. The increase in general fund positions includes 3 animal care kennel techs, we'll look at that in a little while, 2 animal care dispatchers, 1 veterinary assistant, and the conversion of 1 temporary veterinary assistant position to a full-time position. The reduction in grant-funded positions is in the grant monitoring division, and there is a vacant position there. And no personnel have been impacted by these reductions at this point. So slide 20, here's where we talk about the general fund. And the general fund budget for the Neighborhood Services Department is $8.3 million, with animal care services making up the majority at 57%, then code enforcement at 36%, with the remaining 7% making up housing and homeless services. Together with the general fund and grants, homeless services comprises 10% of the total budget, and affordable housing comprises 18%. You'll see on the next slide that the budget leverages program grant funding to support high priority needs such as homeless services, affordable housing, and code enforcement. Homelessness and household services includes fair housing, Americans with Disability Act compliance, and homeless services. So here we are at grants. Grants included in our budget for fiscal year 2023 include awards from the U.S. Department of Housing and Urban Development, and the Consolidated Annual Action Plan was approved by Council, thank you very much, on July 26th. The CAP, the Consolidated Annual Action Plan, authorized the city to award $5.6 million in grants for fiscal year 23, and that funding supports 11 code officers and 12 grant monitoring staff. The proposed projects include utility assistance program, minor home repair, single-family rehabilitation, code demolition and clearance of vacant properties, new box truck and generator for the Nutrition Education Center for senior meal delivery, and emergency shelter, rapid rehousing, homeless prevention, tenant-based rental assistance, and land acquisition for construction of single-family affordable housing units. The grant budget also includes homeless housing and services program and ending homelessness fund monies from Texas Department of Housing and Community Affairs and private donations. Once again, together with the general fund, the city is investing 10% of the department's budget into homeless services and 18% of the department budget into affordable housing. Grant funds enhance and stabilize our community through code enforcement action, demolition of blighted properties, clearance of vacant property, providing meals to seniors, providing access to homeless services, and providing support to homeowners through repair and rehabilitation. Through program delivery dollars, the city provides technical assistance to sub-grantees, meaning the people that we contract with to provide the services, monitors every award for compliance with rules and regulations, works with HUD, Housing and Urban Development, to ensure that the city remains compliant, and provides household eligibility review and repair and rehabilitation project management. Here we are, slide 22. We're going to talk about our enhancement proposals now. So as you can see on the bar chart here on slide 67, Council authorized an increase in the number of code officers over the past 3 years, +1 in 2020, +2 in 2021, and then this year +9. And that includes 4 officers for enforcement of the short-term rental program. In order for us to enhance and sustain best practices, we need to stabilize the team, provide training for staff, assess workflows, standardize approaches, and develop a plan to align everything we do to industry best practices. We'll be looking at efficiencies, best practices, and looking at creating specialized teams. This approach supports the department focus on stabilizing, enhancing, and sustaining, and also effective resource management. There are currently 8 vacant code compliance officer positions, and we routinely carry 3 to 5 at any point in time. This reflects an 11 to 18% vacancy rate. However, right now, with 8 vacancies, we're at a 28.5% vacancy rate for code officers. An effort is underway right now to fill all of those positions. We just conducted a recruitment process. To assist with retention, boost productivity, and increase efficiency, $205,000 is being proposed for training and development programs. And that is an approach that has been proven effective in other departments, like Development Services. We hope to replicate that process in Neighborhood Services. Really, retention is something we need to address. It's a critical need. In addition to stabilizing the workforce, $100,000 is proposed for business operations and strategic planning. That aligns back up with assessing our processes, looking for efficiencies, and aligning to best practices. We'll accomplish this through a combination of a consultant contract and then a very robust and comprehensive review of our current standard operating procedures. Those haven't been updated since 2014. So we need to review and update those outdated policies and procedures. We need to review and enhance our equipment and our vehicle needs, and then review code compliance workflows, staff productivity, and make recommendations for improvements to streamline processes. Some of these recommendations will come through the city manager's office in the form of legislative updates for the council's consideration. Now we'll move into slide 23, where we talk about animal care service enhancements. The current vacancy rate in animal care is 13%, or 6 of 43 total positions. To promote retention and reduce our attrition rate, we propose converting one of our existing temporary positions to a full-time position. That is a veterinary assistant position. And then bringing on an additional full-time vet assistant that will help with coverage of the current medical care needs at ACS. And then we have a full-time vet assistant, so with that we'll have 2. And when we bring on we're trying to fill the vacant veterinary position, then we'll have a fully equipped staff to deal with supporting 2 full-time vets. This is consistent with industry standards and also provides the assistance that we need to take care of the animals.
Linda, and if I may, do we have the space for 2 full-time vets and everything else?
We'll have to make space when we get the full-time vet, and that's part of an assessment that we need to create to go through Mayor in the first part of 2023 fiscal year to assess our space needs. Right now we have the 1 vet, and when we get the 2 vets on board, we'll have to look at what we need. The benefit of supporting the mobile clinics and the other service providers for things like spay-neuter is that it increases our capacity, where capacity, we don't have that capacity right now.
Right, correct. Okay, thank you.
So to address the needs of animal in our care, 3 additional full-time kennel technicians are also being proposed to increase the quality of care for the animals in our house, so to speak. We currently have 6 positions and all are filled. That's a really good thing. However, adding these positions, again, is consistent with industry standards for animal care. To address the calls for service, 2 full-time dispatchers are requested to improve the efficiency of our field operations. This means we'll be able to improve our response times. This is critical to animal care services. Being able to prioritize where the animal care officers go and how we get them there is really important to addressing the needs of the animals as they come in. To address overpopulation and address a need in the community, additional funding is also proposed to have our increased partnerships with our spay and neuter agencies, and I'll talk a little bit more about that. That funding will be made available for community partners through a competitive funding process to be initiated in October. I'm almost finished, Council.
Right, and Linda, let me just repeat that, because that's an important part where there's been some misinformation. So we're recommending in the budget $500,000 in new funding for spay-neuter services. That'll be competitively procured. So we'll put an RFP out or an RFI or an RFB, some type of proposal process to see what agencies out there want to partner with the city to provide spay-neuter services. It could be in a mobile fashion. It could be at their own clinics. It could be numerous scenarios. So what we know is we need more spay and neuter, so this will be a way to increase those surgeries. There's no promise to anybody, no agency on who would get the $500,000. It would be 100% competitively bid, and that would begin, if the council's approved, if the budget's approved by the council, it would begin sometime in October. And if I can, since I have the mic too, I do want to remind council that we have a long way to go in animal care, and we know several on the council, including the mayor, have been strong advocates for this operation. We have some strong leadership with Linda and others, and Joel, that are managing the operation. But until recently, like the last couple of years, things like kennel attendants, managing the kennels, were done by temporary employees. And there was huge turnover. And this is a full-time job, 24/7. So we converted temporary positions to full-time kennel attendants. Now we're adding even more in this budget
Do
recommendation.
any of those, Peter, excuse
What-
me, do any of those include the people at the front desk? The permanent versus temporary?
The customer
If
service
they were.
reps.
I'm. at
We're
one point they
converting the
were.
one position right now from temporary to full-time. Mayor, is that
That's
what?
kennel. Oh.
Oh,
Yeah, the customer of that part, somebody to help those coming in to adopt.
is the question, are we increasing?
No,
I guess the question is, how many people at CCAC are temporary employees overall
you don't,
Temps.
let's see, go.
versus city employees?
Mayor, City Council, Joel
You want to turn that on, Joel?
Oh,
There you go.
Mayor, City Council, Joel Skidmore, Animal Care Services. Currently, we have 3 temp positions at ACS. It's the veterinary assistant that you see on the screen that we're requesting to be converted to full-time. And we have 2 front desk senior staff assistants that are currently temporary positions.
Okay, so the 2 at the front.
Okay, there's no recommendation to convert the temporary to full-time?
Right now, sir, and we're looking into what we can do to help convert those to full-time. What the benefit of the dispatchers coming on board is they will help assist with the duties that the senior staff assistants are doing. So instead of just having 2 dedicated people helping the front, the citizens walk in, we'll have additional expanded services in the front area to answer questions, also still while maintaining and monitor the field process for the officers. So instead of just having the duties for 2 specific people, it'll be equitable spread out between additional people in the front. But I agree that the temporary positions is something we should look at converting to a full-time position.
I would say so.
Okay, yeah, thank you for bringing that to our attention, Mayor. So, and then one other thing too that's new is the dispatchers. So we know we have calls for service, right, for animals, and up to this point, there's no dispatcher. So it's been kind of an ad hoc job where somebody that's assigned to some of the duty would dispatch out. So this will add 2 dispatchers to cover all shifts, where they can, once the call comes in from our new 311 system, that's their only job, is to dispatch it out to one of the ACS officers that is in the field. So these are just good examples to show that we have a long way to go. Our animal care services operation is running pretty decent, but it hasn't caught up to the times, and these are some of the initiatives that we've been doing, and I just want to highlight them to say we know that there's still a lot of improvement to be had there at Animal Care Services, but we do appreciate the council's support and advocacy for improving those operations.
May I, thank you, Mr. Zanoni, thank you, Joel, and Mayor, to your point, similar to what we are bringing forward this year in terms of a proposal for retention and development of code, the code team, we anticipate doing something similar, making some similar requests next year for animal care services after we have a time to dive in to how the operations are going. With the additions of these staff, if council approves, then we have some information about how this is helping us with that front office operation.
Right, which is critical. Yes. Councilman Pusley?
Okay, can someone explain to me on this $500,000 for the spay and neutering program, how is that utilized? Are we providing those services to the general public? Or are these animals we pick up off the street, or how's that money going to be spent?
If it's okay with you, Mayor and Councilmember Pusley, may I advance through this slide and then land on the final slide, which covers our approach to the 500?
Okay, that's fine. I've got
Is that
several
acceptable?
questions associated with animal
Yes, sir.
care I want to get to.
Yes, sir. So before we detail the approach to increasing our spay-neuter partnerships, we just want to highlight some of our partners helping us provide services in our community. This is a list that is not inclusive of everybody who operates in the community, but we wanted to call out People Assisting Animal Control, or PAC. Since August of 2010, they've been providing no-cost or low-cost resources for pets in our community, from surgeries, preventive medicine, and responsible pet education. They are a good partner for us in spay and neuter. They've been operating as a nonprofit with their own money for years. Pee-wee's was established in May of 1997. They've been taking animals from ACS and from the surrounding area. Not only do they help homeless animals find homes, but they offer low-cost and no-cost spay and neuter surgeries and preventive animal medicine. Gulf Coast Humane Society, they were founded in 1945, and it's their mission to provide shelter and care for homeless animals through adoption, fostering, community partnerships, education, and they also perform spay-neuter services. And also provide vaccine services. The South Texas Animal Rescue, or STAR, they're also a nonprofit animal rescue that takes in animals in need. They perform spay and neuter services. They vaccinate animals. They've recently expanded their resources and now operate a spay and neuter clinic. We'll get into a little bit more about that in the final slide, which is next. The Cattery Cat Shelter, beginning in 2007, the Cattery has been offering an alternative to traditional animal shelters by providing cage-free haven for homeless, abused, or abandoned cats. Additionally, they provide preventive medicine and operate a low-cost spay and neuter mobile clinic. In addition to these organizations that you see on the slide, Mayor and Council, there are individuals and volunteers throughout our community who visit the shelter and or participate in rescue efforts, and we want to acknowledge them as well. We also want to recognize the valuable contributions of our Animal Care Advisory Board. All of these partnerships are critical to addressing animal welfare and care needs in our city, and we're committed to continuing to support these partners and also welcoming new partnerships as we look into increasing our network of services of assistance for animals. This is our final slide, and we want to highlight a pilot program to increase availability for low-cost or no-cost services and leverage resources. What we're talking about here primarily is the initial, the pilot program that we started with STAR. They received a donated mobile clinic, which is equipped to perform spay and neuter surgeries. They approached the city with a request for funding to assist with the purchase of supplies. And we put a 3-month agreement in place to provide $49,000 for them to reimburse them for the purchase of medical supplies. And that agreement expires at the end of September. As Mr. Zanoni was saying, in the beginning of fiscal year 2023, which starts in October, if approved, there will be $500,000 made available for the community for providers to apply for funding to increase our capacity to be able to provide low or no cost spay and neuter services and some preventive medical and vaccine services throughout our community. We simply don't have the capacity at ACS to do this. There are organizations in the community who are doing it, and we want to be able to build their capacity and increase our capacity as a community to serve the needs of the animals. Our investment of $49,000 in STAR, these were public dollars, that leveraged more than $300,000 in private funding that STAR received for that mobile clinic, and then also for some of the operational costs that they've been incurring. This results in a 1-to-6 return on our investment, public money to private money. We mentioned earlier that the voucher program with People Assisting Animal Control, or PAC, where they provide vouchers for ACS to provide access to heartworm treatment for animals adopted from ACS. We're also talking with PAC about how to support their spay-neuter efforts, which will be part of our process to award funding in 2023. We're actually engaged with them right now and some other folks about what we might make possible for them in the immediate time. So with that, Council and Mayor, that is my presentation for you today, and I'm here to address any questions that you have.
Mm-hmm. Thank you, Linda. Councilman Barrera? Well, his light was...
I'm just going to say something real brief, I'm sorry. Linda, I just wanted to comment on what a great team you have. I can tell you that they're responsive, and of course the ones I deal with are Joel, Jennifer, and Bobby Joe. So what is it, or Bobby Ray? What is it? And I just, they're responsive, and they're dealing with difficult issues, mostly with somebody complaining. And, they handle it so professionally, and they're problem solvers. And I don't have interaction with the rest of your team, but I'm sure it reflects on the rest of them. So I just wanted to give you that much appreciation that I have for when I'm working with your team. So,
Thank you, Councilmember. It's all about the team. I'm just here to provide support for them. Thank you.
Thank you. That's good leadership. Appreciate you.
Councilman Smith.
Thank you for the presentation, Linda. I'm glad to hear you're really looking at code enforcement and addressing the turnover issues. I think that's something that has always been an issue with codes. So the fact that that's high on your priority list, and we know the importance, we have the authorized positions, if we don't have them filled, it doesn't do much good with it. And then jumping to the STAR program, so how many spay and neuters, we're providing supplies, so what does that equal out in spay and neuters, the $49,000? Is there any correlation there that for $49,000 we get X amount, or supplies for X amount?
So there was no correlation to that. We were requested by STAR to help them by purchasing supplies.
Yeah.
And so those supplies may actually go toward things like vaccinations or heartworm prevention, those types of things.
So it's more general than spay and neutering?
It is more general. Part of their commitment, though, to the city council member is to prioritize animals who are at ACS, at animal control or animal care. And so they are supposed to prioritize spay-neuter services for our animals. And to date, I think, is it 40? Is it 40 animals? 40 animals? Total.
Yeah.
Total. It was 34 the last time we talked. Is it 40? The last time I checked, it was 34, but I think we have 34 total animals that we've received. We're supposed to be referring 25 a week, but because of the condition, the health condition, or the weight, or the age of the animals, we may not be able to get them 25 a week. But since they started in July, we have been able to access 34 animals from ACS. That doesn't include the animals that they are servicing from around the community.
Okay, and as we go out for the RFPs, are we going to have some specific, will we be paying then for spay and
Yes, sir.
neutering? So it will be a more itemized list than
Yes, sir.
Okay.
We have done an analysis of what it costs to spay or neuter an animal in all of the clinics across the community, and we're establishing a range based on the weight of the animal and actually the gender of the animal. It's different to spay
sure.
a large dog than it is to neuter a small dog or a cat. So we had to do an analysis. We're putting together the request for proposal draft right now. So we'll have a range, and then we'll have a target for what we want to, have those costs be.
Okay, thank you very much.
Welcome.
Councilman Hernandez.
Yes, thank you. And that generous donation of the $49,000, I've never gotten more complaints about it. A good deed. I guess it's a whole saying, there's no good deed goes unpunished. I hope that we learn from that and not do that again, in the sense of not being inclusive, and I'm assuming that's what that $500,000 is for. I noticed in your budget you have an increase from $50,000 to $600,000 in your professional services. So I'm assuming that's where that $500,000 is going to.
Yes, sir.
So what's the additional $50,000 for?
I would have to look at what that is and get back with you.
Okay. In terms of short-term rentals, it's not quite part of your, I guess, your budget here. Where does it lie in the budget, just so for my information?
It's carried in planning.
Carried in planning?
Mm-hmm.
Okay. Thank you. I couldn't find it, so I appreciate that. Other than that, in neighborhood services, under your neighborhood services administration, you have a $250,000 budget for professional services. What is that for? That was not budgeted last year. As a matter of fact, you only had $2,500 budgeted last year.
Oh, this is I'm sorry, I have the answer to that. It was a business facade improvement for the Leopard Street corridor that was originally included in our budget, but will be transferred to the economic development budget. So it was originally in the book, included in our budget, but it will be transferred out of our budget to be managed by, hopefully by the new economic development department.
Not hopefully, it will be, yeah.
Okay, so it's currently in your budget now, but it will be transferred when?
As part of the reconciliation, as part of the adopted budget, we'll make that an amendment for the council's consideration. So we initially, we have a facade improvement program recommended in the budget, and we'll talk about it when we do the economic development department. We initially had put it in neighborhood services, but after further review, it made better sense to put it in the economic development department. So when we talk about economic development, which will be the last meeting, we'll talk more about that program that comes from input from Councilman Pusley and Lerma. And we'll talk about it then, but then we'll make that transfer as part of the proposed to adopted budget amendments.
Okay.
Yes, sir.
Well, anytime you have something like that, doesn't make sense. It stands out, so.
Right, yeah, that's why we'll talk about it when we have economic development, but we'll move it as well.
Okay, thank you.
Councilman Pusley.
Okay, Mr. Stewart, thank you very much for the presentation, and you and I have had a number of conversations over the last few weeks, and I appreciate your time and effort and working with you and Constance, especially with regards to code enforcement, and y'all have made some great improvements in code enforcement, and we all appreciate that, and I look forward to additional things. And Peter, one of the things that we found out that needs to be addressed is we have a number of ordinances on the city's books that are really outdated for code enforcement, and one of them is a game that people are playing with the city, and that is on demolition of buildings that are no longer structurally sound, is they can go to the city and apply for a 180-day permit to demolish a building once we've ordered them to demolish it, and they just keep going down every 180 days and renewing that permit.
Yeah.
And so we've got buildings in this city that have been sitting for years through that process, and we need to change that ordinance. It needs to be updated, and Mr. Stewart and Constance and I had several discussions about that, so hopefully we can look into that pretty soon.
I appreciate you bringing that up here, Councilman. We're supportive of that recommendation.
Yeah.
And we need to. We know that this council, again, approved a monumental item, which is demolition of facilities that are damaged by sudden acts of
nature.
Yeah, of nature. So to include, most recently, we had 2 fires in the last week.
Right.
Both of those buildings, both those structures, one not too far from City Hall, are deemed unsafe. And in the past, they would have been left there, maybe boarded up. But now our aggressive ordinance says they have 3 days to prove they can be rehabilitated. And if they can't do that, the owner has to demolish them. And if they don't, we will, and we'll lien the property.
Yeah.
So these are good examples of changing our ordinances, and we'll look at the ones that you just mentioned.
Yeah.
Part of Linda's assessment of code compliance is just that, and she mentioned it, looking at all the ordinances, the business processes. I think she said they haven't been updated since 2014. So we need to do it. That's why the focus in code compliance was not to add more positions. We have vacancies, so it's rather to reestablish a modern business process to include these ordinances and be more aggressive with the staff that we do have to help clean the city up.
Yeah, you know, I showed him a house on Leopard Street that's been abandoned since I was in high school.
Yeah,
and that was a long time ago. And the owner keeps doing this game with us, where every time his permit expires, he just goes and gets another one. So
we'll fix that.
Okay, so I want to skip over to page 20, and please excuse me here. This is not a criticism. This is just an observance. But if you look at this pie chart, it's we're spending more on animal care services than we are services for homeless and housing. I mean, so how did that happen, and
So, sir, what you are looking at is the general fund. We have over $5 million that has come in through the council-approved consolidated annual action plan that is funding additional services for homelessness and housing needs in the community.
well, I saw that, but somewhere there ought to be a chart that shows what we're doing for, a total number of what we're doing for homeless people, and I know we have money in other budgets, Peter, where we address that issue too. I just think that presents something that the public may not understand.
Okay, yeah, that's a good point, Councilman. As part of our follow-up to you, we'll combine these two funding sources, 8.3 and the 5.6.
Okay.
8.3 general fund, 5.6, and then have a different representation. That'll give a clearer picture of how much we actually do spend on housing and homelessness. Yes, sir.
Okay,
Good
'cause,
idea.
that question comes up every time we
Yeah.
go to one of these budget
Right.
hearings.
Yeah, I've
What are
heard
y'all
it.
doing for homeless and, those people?
Exactly. Good idea.
Okay.
I actually have a number for you. So Homeless Services is receiving $0.4 million in general fund out of $8.3 million.
How much, say that again?
0.4.
0.4
And
million?
then $1 million out of $5.6 million in the grants, for a total of $1.4 million, or 10% of the department budget.
Yeah, I ran some quick numbers, and I came up with 2.5 million, but maybe my math's off a little bit, so,
Happy to talk with you more.
yeah. Okay, and where are we at, speaking of housing, does the infill housing program fall under your department as well?
Yes, kind of. What, do you have
Kind
an
of.
additional question?
Yeah, we have policy guidelines coming to council next week, the updates, Councilman.
Okay.
That will allow for single-family homes to be built at the Development Services Director's approval, and things like multifamily zone districts.
Well, as you know, that's a program that's been near and dear to my heart since I came to this council, and something that I think this city needs to be aggressively involved in, is helping whatever we can do with infill housing. I brought a 15-year-old policy, our policy that was adopted in 2015 by the city, to get it updated, and I don't know what happened. It got turned into something, but as far as I know, Peter, we haven't done anything with respect to providing the services to the infill housing program like we initially intended to. So we turned that to where they were going to have to go apply through the B Corporation to get money from this $500,000 we had set aside, and then we had the Corpus Christi Housing Authority CEO here the other day saying that he's not getting any of the services that we initially said we were going to provide for infill housing. So I'd like to know where we are on all that.
Thank you, Councilmember. And actually, it's August 30th. We're combining some information coming for council consideration, and we'll be doing a full presentation for all council addressing that issue.
Okay.
And we've talked to the individual that you've mentioned multiple times, and to try to offer assistance.
I mean,
Yeah, Linda, let's have Jennifer just provide a little bit of an overview. We do have two we do have two programs. The one that is for affordable housing,
Right.
and then there's one that we use other monies for the non-affordable, if that makes sense. So if they want to build a home that a person doesn't have to qualify income-wise, we have funds to help with those as well. And then we are changing the policy of, that was one of the most significant things that Director Alsop talked to the council about recently, and that's on City Council's agenda next week. But Jennifer has an update here, and then as Linda said.
Peter, that's exactly my point. When the infill housing program was specifically designed to address infill housing.
Right.
Through the city basically providing inspections and permits and sewer taps, whatever the case may be, to help these builders who are doing these infill housing. And so that got, when I brought that forward, just to update that plan, because they just wanted one change.
Yeah.
And that was the cost of the house that was presented. It
Right.
got mashed into this affordable housing program, and I still to this day believe those are two separate programs.
They are, and so in the current year budget, we added funds to address the non-affordable housing, infill housing.
Okay,
So the policy's been updated to reflect a higher price point for the home.
okay,
And we have two different funding sources. The federal monies for the qualifying, meaning you have to be income eligible. And then in the general fund, we have non-qualifying money, the program we put in this year's budget, not the '23 budget, to address those homes that are sold to somebody that doesn't have to qualify or doesn't qualify.
Okay.
So we have everything in place now. And next week will be one more change that Director Alsup recommended, which is that if you want to build a home in a non-single-family residential zone district, we can now with the change next week.
Okay.
It would just take Al Raymond's review of it to make sure everything's good. But an example is building a single-family home on a lot that's zoned multifamily. And in the past, you'd have to come to council for a change of the zone.
so if we update those policies next week, then all of this will be underneath the 2023 budget
Yes, right,
and addressed in that budget.
yeah.
Okay.
And Jennifer has just a few more updates.
Yeah, so Jennifer Buxton, Neighborhood Services.
You can turn your mic on, Jennifer.
Jennifer Buxton with Neighborhood Services. There was $100,000 in the FY22 budget for the non-qualifying home buyers. Now we have 13 approvals on those applications. 9 of those are Thanksgiving homes. Those approvals, the asks for those were $77,000. The first of those homes will be coming online October 1st. That's the date that the builder gave us for the first home to come online. We have turned down 10 homes. They have to date paid out about $15,000 in fee waivers. Those are based on the requests. And in the FY23 budget, this is a recurring program, so there's another $100,000 in FY23.
Okay. And where are the $100,000 increments coming from?
Excuse me?
Where are the,
Those are, in the FY22, council approved $100,000 of general funds. And then occurring, or in the proposed FY23 budget, there's another $100,000, establishing this as a recurring program.
so how do they access the $500,000 that were provided to the B Corporation?
That's the separate program.
Okay.
It's a similar guide that if a home builder says, I'm going to sell my home to a qualifying individual based on income, we would use that pot of money, the type B money, because that money is for affordable housing. So we have two funding sources. We can't use the affordable housing money for non-affordable buyers. That's why we put additional money in the budget, the $100,000 in the general fund.
Okay.
Does that make sense? So there's two funding sources for two different home qualifying participants.
Okay.
And as Jennifer said, that's a pretty big number. So there's how many homes in total again? Can you repeat it?
There are 13 homes in the fee waiver program.
13 in the non-qualifying ones.
So those are the ones that fall in the infill housing program.
Right, they do. They both fall in the housing infill
So
guidelines.
they're both considered infill. The $100,000 fee waiver program is called the Fee Waiver Program for Non-Qualifying Home Buyers. The Type B funded program is called the Infill Housing Incentive Program. So they're both infill housing, but one has infill in the title and one doesn't, and I think that's where some of the confusion's coming from. The $100,000 for non-qualifying home buyers is out of general fund, and it has 13
So
projects
tell me
in
what
it.
a non-qualifying home owner is.
It is not restricted by income.
Okay.
Anyone can buy any of the homes regardless of their income.
So did we just do away with the infill housing program policy that was passed by the council in 2015?
We revised that, and that program was now tied to Type B,
Right?
and
That's what I thought.
and buyers have to qualify as low income.
Okay, how many people have qualified through that program?
There aren't any developers in that program now. We have 10 home buyers right now working with lenders, looking for houses, though.
Which is what I said when that came down, was I didn't believe you would ever get an infill housing builder to access that money because you made the stipulations and requirements too strong?
Those stipulations and requirements are tied to the Type B regulations.
But they didn't need to be.
That's why there's the fee waiver program.
The original infill housing program, Jennifer, was specifically designed and passed by the council in 2015 to address the fee waiver program, and that was it. And so we completely abandoned that program and went to one that now is tied to the Type B corporation.
With restrictions, and then there is the fee.
That's right.
And there's then the fee waiver program that's funded with general fund that does not have those same requirements.
I mean, you can say that all you want to, Jennifer, but, and Peter, the fact of the matter is, I made the point of saying when you did that, you were going to eliminate, the people who were running Thanksgiving homes told me, we'll never use this.
Well, that's why we created the second one, Councilman, that's funded at 100,000. So we have two, and we do have to follow the Type B affordable housing requirements. So we
I
can
understand that,
right.
but you could have done that through a different program. To me, you got it reversed.
Well,
If
we
you'd have
fixed
just
it, though.
updated the infill
Yeah.
housing program and left it like it was, and then created another one that uses the Type B corporation money, it would have been the same thing, just in
Right.
reverse.
All that's been fixed, though, at this point. So as Jennifer said, 15 homes are going through, 13 homes are going through the program you wanted.
Okay.
And that's funded fully in 2023. It was funded now. And Gary Alsop's and other developers like Thanksgiving Homes, to my knowledge, are happy. And the final step on that is coming to council next week to make one more change. They allow single-family homes in other zone districts.
Okay.
Like a multifamily, yes,
I'm
sir.
sorry to make a big issue
No,
out
it's
of
okay.
that,
We
but it's
appreciate it. Yeah.
something I feel very passionate about.
We understand. We can tell.
And I
Right.
discussed this with all of you at length when we did this a year and a half ago.
Right.
So,
Yes, sir. The good news is it's fixed. It's moving forward. The last fix that we know of is next week at City Council.
okay.
And we can assess the $100,000. If it seems like that's not sufficient for a year, we can make adjustments through the year as well. We'll bring that to council.
I'd like to see a report on what we've done at this point with both programs.
Okay, we'll do that. We'll be
Okay.
prepared to do that next week.
Okay, my last question is related, where I originally started out, is on this additional spade and neutering funding,
Thanks, Jennifer.
that $500,000 clip and the $49,000. How is that money being used? Is it being used to spade and neuter animals that we pick up that don't have an owner? Or are we providing that service to individuals who just bring their animals down and say, I'd like them spayed and neutered?
So there are two pieces. The $49,000 that has been already awarded to STAR is to fund supplies, and that's mostly medical supplies to support their operations. Some of their operations are increasing the spay and neuter, right? And some of their operations include things like heartworm medication or vaccines or microchips, okay? They have at STAR a requirement written into their contract that they make space available for animals at animal care services, 25 a week spots, for us to have animals in our shelter who must be spayed or neutered as part of the adoption process to receive spay and neuter services. We have encountered some challenge with them being able to meet that because of sometimes we have a young animal, an animal who's medically fragile who can't have the service. And so and STAR isn't only providing the services for ACS animals, they are have opened their services to the entire community. So that's the $49,000. That contract for services, a reimbursement contract for medical supplies only, that expires on September 30th. In October, if the proposed $500,000 to increase spay neuter services is approved by council, we will release a request for proposals from a variety of organizations who are interested in providing free no cost or low cost spay neuter services. If you're asking me who can access those services, it can be through a voucher program that we provide from ACS. We give them a voucher when an animal is adopted, and they can go to a service of their choice. We perhaps list on the back of the voucher the funded providers who will provide the spay-neuter services. Folks who are on a restricted income, folks who don't have the resources to spay-neuter, microchip their animal, microchipping is required by law, and so we want to be able to assist folks who may not have the resources to do this on their own outside of the adoption process. We also want to increase access for spay-neuter for folks who are out there dealing with things like cat colonies, right? To address issues of overpopulation. There are folks out there who are trapping cats and getting them spayed and neutered to reduce the overpopulation. So it will be a variety of opportunities for a variety of reasons. Folks who can't pay for it on their own, folks who are very active in the community to try to address issues of overpopulation, and folks who are adopting animals from our facility who are required to microchip and spay and neuter.
Okay. So my point here in asking this question is, this is not just, and I think it's important to explain this, it's not just that if I had a dog or a cat, whatever, and I brought it to the city and say, hey, I want you to spay and neuter my animal for me, when I obviously have the resources to do that on my own.
The intent of the program is to make the service available for people who can't typically pay for it on their own.
Okay.
We will need to reflect on how we require proof that they are not able to
Right.
to provide to pay for that service, and that's something that we'll put into the request for proposals. How will the funded organization make that determination?
Okay. Okay, thank you.
Yeah, it is income, I'm sorry, Counselor, it is income eligible, right? Just like the,
It can be, yes.
okay.
Yes.
The 49 today with SAR is income eligible to some extent?
So the 49 with STARS is for medical supplies. They do not do income eligible, they do not have income eligibility as part of their program.
But I may add,
Yeah.
they go to areas
Yeah.
that are, that would fit that,
Okay.
but for that reason.
Yep.
And there's a higher number of stray animals.
Yeah, and PAC as well, they operate in the zip codes that are feeling financially.
No, I understand that, and I think it's important that we focus on that and that we get that message out, because, Peter, the message could be quite different if we're not careful.
Yeah, we agree, Councilman.
So
One of the messages we wanted to make clear today is the STAR, the $49,000 pilot program, which STAR is a 6-to-1 or 1-to-6 leverage ratio, so they bring over $300,000 to the table for our $49,000. So that's a huge return on investment or leverage match.
I think it's great.
For every $1 the city put in, we get $6 in return to help
Yeah.
spay and neuter. That's tremendous. So
Yeah, no,
Yes, sir.
I agree with that. Well, again, thank you very much, and thank you for the great improvements in code enforcement. I'm very excited about that.
Yes.
So it's long overdue. Thank you.
Councilman Hunter?
Thank you, Mayor. Sorry, I've kind of lost my train of thought. No, it was way before you started. It's probably when Gil started over there, so just kidding. First of all, I think that y'all do a great job and you're heading in the right direction. I just want to give y'all some things that may help with the budgeting for next season. And it's something that we tried to do in the past, but there was a little difference in opinion on how to go about it. But one is the low-hanging fruit on downtown for code enforcement. Maybe not focus on people that are 2 seconds over their parking payment on all the parking spots downtown, but the 15 to 20 giant buildings that could give us a lot of revenue for being vacant and dilapidated forever, and maybe actually start fining them. Live release guidelines. My family's been a part of that procedure. We think it works very well. Y'all did a great job. So I got a real personal perspective of it. In fact, I had to help my mom catch the cats. Long story short, those are not our cats. They are
No,
not our
I
cats.
helped your mom with that too.
Yes, you
recently.
did. Yes, you did. That was the second time around. Those are not our cats. Unfortunately, someone passed away. She had a lot of cats, and they bred, and the neighborhood's kind of working together to get it under control, and y'all have helped with it. Some things that were confusing to some of the neighbors is maybe y'all could give them a little bit more of an idea of how the live release works, because one of them was kind of upset that the cat didn't make it back into the neighborhood. So, and then yeah, I guess that's it. I think Councilman Pusley touched on a few of the other things, so I just wanted to add those two things in there. And I'm sorry if I've been frowning. It's not because of y'all. I think that y'all are great. I'm trying to turn it upside down for y'all. I'm just, unfortunately, we're going to have to add another budget meeting, and that kind of upset me. And we may even have to have another one after this, because I doubt Development Services is going to end in 45 minutes. And just for the record, I think next time we should do this before August, instead of giving, all of us up here have supported y'all. Sorry, this is more directed at Peter, sorry. All of us up here have supported y'all, but the people that are trying to come in to take our positions up here are not supportive of y'all. So instead of giving them an upper hand at the beginning of campaign season and having the budget
That's a good point.
focusing right here, we should probably do it a little bit ahead of time. Just throwing that out there, because we
Yeah.
do support y'all, and they're going to be coming after you, so we're giving them a huge,
Okay.
huge
That's a good
lead
point,
right
Councilman.
now.
Good point.
Thank you.
Okay, so Linda, thank you. All of the staff, thank you for all the different parts in which you take part. And it is no secret, I am a big animal advocate, and I cannot tell you how, and I know Councilman Molina, Councilman Barrera, those are the two districts that stray animals and this spay and neuter and all of this affects the most. So we're not going to sugarcoat anything. You don't have a bunch of strays running around on the island or South Side or, where else? Cal Allen, you probably, I don't know. I've never gotten calls. It's 2 and 3. So what we're doing today and what I truly, Linda, expect, and this is a great time for you to come in and use this as a milestone, is improvement. I'm not going to sit here and go through, you already know it though, go through some of the things I'd like to see improved, but I will say 2 words and what it comes down to. And they sound a little antiquated. I'm sure there's a new word for customer service. And everything falls under customer service. The people who are sitting at that front desk, who will have more investment in their jobs if they were actually a part of this team in terms of being city employees. Every kennel tech, every vet assistant, I don't have to tell you that, but we do need to raise the bar. We cannot tell people on the phone that we are not taking animals. If we have to say that, we should be saying, however, let me give you a number and a name of an organization who is taking animals or who can possibly help you. The smallest things, because we're supposed to be helping people and we're supposed to be taking people in their taxes are paying for the service. So I understand there's always a right limit to capacity, but there's also always a way to help someone find what it is they're looking for. So I will leave it at that. Thank you all very much for all the work you do across the board. Code enforcement, all of it is extremely important. I just always seem to have that strong advocacy for those animals. So thank you again.
Thank
We
you.
appreciate your time here,
Thank you.
everyone. Yes.
Thank you, Linda, and your team. Al Raymond's going to come up now to finish off this budget work session.
Okay.
And we're going to cover development services. Al, come on up. I will say that Al has worked with the development community. Okay, Al has worked with the development community on his budget proposal to include a scheduled rate adjustment that we talked about last year with them. And I'm not sure if Councilman Barrera has received any calls, not from Miss Wendy Herman, but the fact that they're not here today maybe speaks to the fact that Al's done a good job making sure he's networked with his partner agencies and developers. So Al, we'll turn it over to you.
Thank you, sir. Give my team a chance to get set up. Great Grayson. That's great. That's great. Okay, got you. Okay, hi, Al Raymond, Director of Development Services. I brought my executive team here because I wanted you to put faces with names. Some you know, some you do not. So Grayson Myers, he's been with us about 1 year in October. He's our new business manager. Of course, you know Michael Dice, Assistant Director, Nina, Assistant Director. Michael Dice, Assistant Director over the Building Division. Nina is Assistant Director over Land Development. Andrew Dimas, of course, all of you know him. Development Services Administrator and Land Development over Zoning and Plating. Yvette Wallace, a lot of you know her. Development Services Administrator over all things permitting, front counter, our call center, and our receptionist. Luke Fry, our Deputy Building Official. Luke is over plan review and inspections. Bria Whitmire, she's our new Development Services Engineer. She started Monday. And Joanne Salinas is our Assistant to the Director. She's a Senior Management Analyst. That's my team, so I wanted to, you to put faces with names both ways, so you can reach out. These are our ambassadors, so to speak. So engage them when you can if you have an issue. Of course, all of you know you can email, call, or text, or whatever, and one of us will respond. So I'm going to present Development Services FY 22-23 proposed budget to you. Our mission statement, we changed it a little. I changed it a little, right? Our mission, Development Services, is to implement and enforce sustainable development regulations to build strong communities, enhance economic opportunities, that should say, and ensure a dynamic framework for quality growth and development. As we do this, as we work to achieve this mission, we will provide first-rate customer service. The mayor talked about that a little. Continuous process improvement, which our business constantly changes every day, and ensure our staff is knowledgeable and experienced. About development services, and we do a lot, and many of you know that from residential plan review and inspections, commercial plan review and inspections, MEP, mechanical, electrical, and plumbing plan review and inspections. We handle rezonings, we do platting, we do public improvements, a lot of things we do, but this slide basically shows there's a constant uptick in the demand for our service, right, which is the framework for our decision package. So just real quickly, in 2020, and we looked back 5 years to 2017. So in 2017, for residential permitting, we issued about 1,600. When we closed 2021, we had issued over almost 3,500, which is a huge increase, and which shows that there's a demand for our service. In commercial permitting, we issued in 2017 about 632. At the close of 2021, we issued about 838. So again, a slight uptick. Not as much as in residential, but it's a huge uptick. In our mechanical, electrical, and plumbing, our trade permits, we call them, in 2017, we issued 6,839, and at the close of 2021, we issued over 13,000, right? So just kind of a brief snapshot just so that there is a demand for increased service across our entire department. And I talked about it a little. Of course, Mike Dice is Assistant Director over Building Division, which handles plan review inspections and permitting. Luke Fry and Yvette Wallace work under Mike Dice. Nina Nixon-Mendez is the AD over Land Development. Andrew Demas and Bria Whitmire work under her. And here are some of the accomplishments, which many of you have been involved in, of course, over this year. The Historic Preservation Plan was one, and I think that's a huge accomplishment. We facilitated implementation of the short-term rental. That was sort of big, too. The military compatibility area overlay districts, that was approved yesterday with the second reading, so that's huge for the city, I think. And by the end of this month, or perhaps early September, we'll implement our STAR program, which is our contractor registration program. STAR stands for Safety, Training, Accountability, and Registration. It's just a way of professionalizing those group of individuals that do work in inside the community. Here are some of our performance metrics across our department. And again, just to be brief, for example, if you submit the residential plan to Development Services and it's deemed complete and you pay your fees, 3 business days, your review should be complete. In the coming months, I should say, we have one production builder here in the city of Corpus Christi. Lennar has purchased Walker Holdings in the northwest area of the city. And Lennar has huge plans to drop 500 homes before the end of this calendar year, and we're already in the 6th month or the 7th month, 1,000 homes in the next year and 2,000 homes in year 3. So there's a huge, despite what the economy says, there's a huge demand for services in this community because we're still developing and growing. For our commercial plans, we try to get those out within 10 days, 10 business days, and our inspections are next day, right? So if you call for inspection today, we try to get to that job by the close of business the following day. Our zoning cases, from a zoning case being submitted to us, being deemed complete, and the applicant pays the fees, 90 days or less, we try to get it to Planning Commission. We try to get it to Planning Commission and on the City Council agenda. Same thing for plating. It says 75 days. Sorry, that should be 45 days. When you submit a plating application and pay the fees and it's deemed complete, 45 days or less, we try to get it to the Technical Review Committee, which is TRC, and ultimately the Planning Commission agenda within 45 days or less. In public improvements, which also I talked about, it shows a little bit of uptick. We try to review public improvements once submitted and deemed complete, and of course fees are paid. We try to do those reviews in 25 calendar days or less. Here's our proposed budget, $15.9 million. To the left, you see a pie chart. 37% of that is our building renovation fund, which is about $5.9 million. That number came from an opinion of probable costs because we hired a local architect to do a feasibility study, and they gave this number that says, this is what it's going to cost to do what you want to do to our building. So we've been asked to transfer that to a CIP fund. So our operating budget for the next year is about $10 million. You see on the right side, currently budgeted right now for FY 2022, I have approximately 71 FTEs or staff members, right? I'm proposing to increase that to 87 with this year's budget, and I'll explain why in a second. Again, this is a look at our overall budget. The outside circle represents revenue, which looks at our plan review. It looks at interdepartmental and administrative costs, licensing, land development, and public improvements, permitting and inspections, and our revenue total is about, for next year, about $9.5 million. Of course, in the center circle, that's all of our expenditures, right? Our operating expenses is in our capital expenses. Last year, council approved this ordinance, which basically allowed Development Services to increase our fees over a 4-year period, 10% each year. Currently, we've increased it 10% in FY 21-22. We're looking to do the same thing in 22-23. As Peter said earlier, one of the things that was asked of us when we got this fee increase was to present to Coastal Bend Home Building Association, and kind of show them, hey, what have you done for me lately, so to speak. So we've done that, and we always, of course, you may know, we meet with that group monthly, but we met with them yesterday just to go over our proposed budget, or was it yesterday or last week? I can't remember. Yes, sorry. It was last week to go over our proposed budget, and they asked some poignant questions. We were able to answer those questions. And as Peter said, I don't really see them here, but they offered support for what we're doing, right? Because we promised 2 things. We said with our fees, we're going to have service enhancements, and we're going to talk about that a little later on in this slide. And we're also going to perform, right? So, and they like that, right? So they have all of our numbers. They reach out to us all day, every day, mostly weekends included. And we together, I think collectively, we keep the city moving as best as we can. Some of the service enhancements I talked about is the N4 upgrade, which is huge, right? And we'll be presenting to them starting in September on the new software, how it'll work, how it'll look, and how they can integrate, and then put out training schedules so that they can get up to speed with us going to be a complete platform of technology, right? Now we do a lot of manual things. We're going to lead that old way of doing things, and it'll all be on a technology platform. So we're excited about that, and we hope to launch the new N4 in the spring of 2023, hopefully. We're increasing staff. That's one thing we're doing for them because our numbers are increasing. And one thing that says, hey, look, these production builders are coming to Corpus Christi. How are you going to keep up? And so we did some numbers, and we're going to keep up by adding a few staff members so that we can maintain our constant pace. We're looking at reducing some of our service times and our responsiveness, and of course, increasing our staff competency. So our enhancement number one is we're in the third year, and can you believe it? 3 years. This is the third year of our Development Services Certification Pay Program, whereas we've allowed staff there, probably 46 of my 71 staff members are eligible to receive certifications, ICC certifications. And in doing so, it helps, it just does a lot of things, right? It helps with staff recruitment, it helps with staff retention, it helps with staff growth and staff development. And so this will be our third year. We have year one and year two. Year two is the current year we're in now. And keep in mind, when we came here 3 years ago, 0 staff members had certifications, and now 24 of my 46, which puts me at 52%. And of the 24, 9 have certifications above their base, right? So it's a great thing. It helps us. It helps professionalize our staff. It shows our competency. And some of my builders, like Moses and Bart and others, are realizing that now because. Yeah, we're just more deliberate with what we do. They understand what we do and why we do it and how we do it, and I think it makes for a great combination. So this has been very good for Development Services. Enhancement 2, we're looking for 7 new inspector positions, 2 in electrical, 1 in plumbing. Our electrical and plumbing inspections are always, the batters are always behind the pitchers, so to speak, right? So they work a little more overtime than others, and it just helps level the field, and as I said earlier, it helps us keep pace with the demand that's coming for my group. Enhancement 3, we're wanting to add 1 permitting lead, and 1 additional permit tech. Again, as I showed the numbers, and so I'll share with you, residential permits for new construction is up 59%, right? Overall, residential permits are up from 2017, 116%. For commercial permits, it's up about 33%. So there is an increase for demand of our services, and these new positions will help us maintain our pace, if not improve it, if we can. Enhancement number 4, we are wanting to add 2 new plans examiners because of what I mentioned about Lennar. D.R. Horton, who is here, continuously works on their master improvement plans, and they're pushing plans through our system. We made a commitment to the local builders here that, hey, it doesn't matter who comes through the door, we're going to keep pace and maintain our 3 days, and everyone counts on that. And so this additional staff will help us, again, keep pace. On the administrative side, we're requesting 3 new positions, a records management analyst. I really wanted this position when I first got here because my records are just all over the place, right? I need an individual who is responsible, who understands what our retention time is, can even organize our SharePoint, and I have 3, and you probably don't know this, but I have 3 outside storage units that are just full of files and records. It's like, oh my gosh, so I got to get started with someone who can help manage that, organize it, scan it, file it, and then probably, if when ready, we can discard that and probably reduce those 3 storage units to probably 1. 1, administrative support. 3, of course, we need, with the additional staff, there's always need for administrative staff. And then this IT application specialist, that individual will help with the new N4 program. This individual will be really working with Peter Collins' group, but Peter asked me to fund it, and I do see the importance of it because they'll help us manage and maintain and keep pace with the new N4 program, N4, Rhythm, and DigiPlan. And finally, we're requesting 2 positions for our part in the short-term rental ordinance that was passed by council, which is 1 permit technician and 1 planning tech. And this is just a brief overview of where we are with our building remodel, right? So I'm going to put about $6 million transferred out of my budget and put it into the CIP fund. But as you know, in late June, we approved a design contract, selected the design firm to do that, and that hopefully that contract will be signed late August, early September. The design should take about 6 months, which takes us to February, March of '23. The construction documents we put out for bid spring of '23, around April and June. Construction contract hopefully awarded in the summer of '23, which is June or August, and construction will start late '23 and will take probably 12 to 18 months, which puts us in the spring or summer of 2025. That is my overall presentation, council, and we stand by for questions if there are any.
I don't see any questions.
And we did it all in less than 45 minutes.
I know. Councilman Pasley has a question.
Not really a question. I just wanted to say a couple of things. One, Al, I thank you and your staff for doing a tremendous job. Development Services needed some revamping, and I think you all have brought that to the forefront, and I congratulate you on that, and thank you for the job well done. And I appreciate all the times that you've worked with me. I've been, just the other day, we had that issue come up out in the Northwest, and you guys were all over it and took care of it, so I appreciate that very much. And I think it's really important for us to note, Peter, that when because this is not true anywhere else in the country, or not everywhere else, the fact that our community has the number of permits that are being accessed and asked for shows a tremendous growth in our community, and that's a big deal. And so I applaud you all for stepping up to the plate and helping us get that done as quickly as possible.
Thank you, sir.
Yeah, that's great, Councilman. Can I just add real quick that a little over 3 years ago, we couldn't say that what you just said, and in fact, the council then was close to outsourcing the entire development services operation. That's how inadequate their services were. So Al and his team have done a tremendous job bringing this to one of the fastest development services and most thorough in the state of Texas. And we want to continue that forward with their leadership. So we appreciate you highlighting it this morning, Councilman.
Okay, Councilman Hernandez.
Okay, I want to kind of echo some of the things that Councilman Pusley had mentioned. As you know, I'm probably not one to heap praise on people. As a matter of fact, I'm probably harder on staff than any councilman on here. But I have to give credit where credit is due, and I'm glad that you brought your staff here with you so you can hear this personally directly from me. I completely appreciate what Development Services has done over the 3.5 years I've been on council, and what you've done in your leadership. Mr. Raymond is phenomenal, and I want to make sure that you hear that directly from me in front of your staff. The fact that nobody from the Home Builders Association is sitting in the audience.
They're watching.
I'm sure they're watching, but they're not sitting in the audience.
Well, they're watching. They're watching. Thank you, Wendy.
But thank you. But that, it's a testament to what you've been able to accomplish with this. They don't always agree with you. Trust me, they don't always agree with you. But I think you've brought a level of professionalism to this organization that has. Between you and our IT, Peter Collins and his staff, have contributed to this city in ways that is, you don't necessarily see, right? That, the general public doesn't necessarily see. So I want to make sure that I say that publicly and from me personally. So thank you for the work that you guys are doing. It has been noticed. Thank you.
And I just want to say thank you, Councilman. It's the team, right? These guys are professionals. They know their job. We do our job. And, the other day I took a vacation, and I don't think I ever took a vacation and actually enjoyed my time away because competent people make everything possible. So thank you.
Yeah. Well, and Mr. Raymond and team, Michael Dice, good Lord, Demas, everybody, it is from 6 years, and you guys, some go back, obviously before 6, but I always reference 6 because that's when myself and a few others came on, and it's been a game changer. And I don't know how you do it. People look at us and go, I don't know how you do it. I don't know how you do it, because it is a very demanding industry, as it should be. But you have turned it around. And that comes because Peter recognized that the right leadership, anyone can replace anyone. But when Peter came on, that was our number one, I'll never forget. And Mayor Joe McComb was lead. And he wanted, along with the rest of us, that Development Services Department to turn a corner. And Peter, that took you. Anyone can hire anyone. You hired the right people. And that makes all the difference in the world. And Mr. Raymond, I have told Peter this, and I'll tell you, the other piece of this magic is communicating and connecting with us. And you do that. You do that very well. And I am, I don't know how you do it sometimes, but you do. And so I just want to thank you for that, because we're all a team, and when we are out there, and it's difficult for us, but at the same time, we have to know who's on our team. Our team is you. The developers are the customer. And from what I've been told, this department has increased, and I'm quoting, 1,000%. Great leadership, very responsive, and they treat us as customers. That's coming from the Home Builders Association. That's huge, because I know I speak for her right now. That could not have been said for sure 6 years ago, but even after. They are so transparent that we don't even mind the fee increases because they deliver a promise. I'm going to repeat that. They are so transparent that we don't even mind the fee increases because they deliver what they promise. That, gentlemen, is exactly what we do. Sometimes we have to implement stormwater fees or, the impact fees or whatever it is, because we're delivering a promise. People here are ready for change. They're ready for improvement. They know what it's going to take. $325 million doesn't just come out of the sky to fix our streets. We implemented, amongst implementing, the 6 cent contribution, I'll say, that's what it takes. It's an investment. So anyway, thank you for handling that and managing that, because that's what you do every day. And thank you for working with us, the council, because that's one of the hardest things that we do is balancing, just like you do. You guys are wonderful. Thank you.
Thank you, Mayor.
Yes, sir. Mr. Hunter.
Thank you. Yeah, there's no question that y'all set the bar a little bit higher. There's no doubt about that, and thank you for that. I do think, though, the home builders may be y'all's biggest fans, but there's a lot of people that obviously aren't, and y'all know that. If there's anything that you can do to help speed up the process on new business, which means more revenue for the city, means which we don't have to add fees.
Understood.
Because we will have a larger base of revenue. That would be great. And I know y'all are working on that, but that's just coming directly from the public on the other side of things. And I think everyone sees y'all's progress, so thank you.
Thank you, sir.
Okay. Yeah. All right, well, you have a good day, I think.
Great, thank you, team. Just one final thing, Mayor, is that the issue of short-term rentals came up when we talked about code compliance.
Yes.
So next week, at my city manager's report, we're going to do an update on how the short-term rental
Oh, good.
ordinance is coming along. We promised the council we'd do that. I think Councilman Pusley asked for that. So we'll bring an update next week on how we're doing with registering folks and compliance.
Great,
Yes,
thank
ma'am.
you. Okay, well, there being no further business, I adjourn this meeting.